I do want to. Would you mind joining me in the salute to the flag? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I assume that you're here for public comment, but that would be under number 7, ambulance service update, is that right?
We're just here if you want to ask us questions.
All right. Approval of consent agenda?
That would be the
Minutes?
I so move that we approve the consent agenda and minutes.
I'll say.
All in favor signify by saying aye.
Aye.
There was one little thing, and we got that, right, Jen?
Yep.
Okay. I am gonna pass around the check signing for, most of it should work for me, so who hasn't had the chance to fill it in first? Doreen, you wanna go first? For June? Cheryl, we have a resolution under LEC financial report, item 8.
Yeah, want to do the financial report first?
If that's okay with you?
Sure.
Okay. I did make a few changes to this spreadsheet since I sent it, or since Joey sent it to you a week ago. We did get, well, that was, push the button, I did, push the button. We got a little bit more money, COVID rural testing funding, 98,000. The grant from HSU, 2 more grant funds. I added the net loss for April, which was $1.7 million. I rearranged this a little bit, so this is basically what COVID has cost us. It cost us our budgeted profits, including the money we've lost in March and April, a total of $3.2 million. This is grant money which we expect to be able to keep.
Is this in hand or just promised?
All in hand, all in hand. So this is money we expect is a give. So right now, we're ahead of the curve by $1.6 million. We were also loaned, you want to say add to that?
When you're ready.
Okay. We received loans and these amounts from Medicare. These all come in last month at this time, so we already talked about all of these. The only thing that has changed a little bit is they have loosened some of the requirements, repay for this loan, so possibly they'll be able
Is that the payroll protection?
We might be able to keep a little bit more of it than we had originally thought.
That's what I was just gonna tell you.
Oh.
It was passed the Senate today. It's anticipated that Trump will sign it tomorrow. And we just got this. Couple of things that they did that will help us potentially. If Trump signs this, and it's anticipated since the House and the Senate, probably he will sign it. The legislation will expands the coverage period from 24 weeks to 24 weeks from 8 weeks here. That's a significant amount for us. The loan terms, if they are in fact loan terms, will be up to 5 years from 2. Deferral period, loan forgiveness within 10, payback within 10 months, then you have to start making payments. There are several other conditions conditions that have loosened that would benefit us. So it hasn't been approved by President Trump yet, but American Hospital Association is very confident since they were absolutely pushing approval on this. That's, hopefully, we don't have to give back a lot of this.
Did we get our ventilators yet? Or back order?
Probably it'll be in August or September.
I didn't add Lake Medical Supply, they also received $8,000 in a grant for their business, so I didn't put that
For
on.
cable protection?
No, a grant, CARES grant, gift.
MLK Gardens.
Huh?
MLK Gardens. Is
Is
that
that
what
your
theirs?
guards got some?
I don't think I put that one on here either. So, yeah, it's just the hospital.
Cheryl, under the wages, that 428, 450, is that up to date?
Yes,
We've,
that's
that-
additional wages, a lot of overtime, people reassigned. So what I'm keeping track of there again is based on our conversations with FEMA.
Yeah.
And what we can include, which might end up being a FEMA reimbursable expense. It's overtime, all overtime, any overtime incurred by the hospital, as well as a person who's reassigned from their normal job to a completely different job, as well as people you have hired just to do a COVID-related job, like guys who stand up there and direct traffic. That's not a job we had before. So, and some of those people are new to us, they're not reassigned employees. So we still altogether have received almost $17 million. It's sitting in our bank. Okay. So looking at our patient counts for the month, total patient counts are down about 40% in the hospital. Major, not a huge change in the emergency patients, which you would kind of expect. Big change in surgical outpatients. Looking down at ancillaries, lab was down 40%, radiology down 45%, rehab's down 52%, clinics were down 5%, so significant declines.
Did we see a significant uptick in May when things bounced back a little bit?
We are seeing that. I don't have those numbers yet, but, oh, right, and I was just thinking of the last few weeks, but yes, it continues to ramp up. Yes, yes, absolutely, May is going to have better. Gross patient charges for the month of April were $2,098,000. That's about a decline of 40% following our declines in patient counts. When you think about it, our average is 3.5 million, so 2 million is quite a dive. Collections on accounts receivable. Sorry. Collections, what's wrong with me? Okay. March was $3 million. April was 2.7. May did take a big drop to 1.4 million. I think it's intriguing. In February, we collected 22% of our AR. In March, we collected 34% of our outstanding AR, which was $8.2 million. Between March and April, our AR dropped by $3 million, well, $2.5 million. And in April, we collected 25% of our AR. So this is actually kind of in line as far as collecting the balance. That balance sure is dropping. Our days in AR went up to 91 because we're really not adding a significant amount of new AR. When we go back to more normal billing, this should take a rapid decline. Because really, we're just left with old AR. And honestly, probably older and older because the older stuff is going to be harder to collect. There's more problems with it, whatever it is. So that doesn't surprise me. Okay, we did 2 days cash on hand worksheets. This one shows that if we just take all the COVID money out of the picture, we would be at 70 days cash on hand, which is a nice improvement over those last few months. Headed in the right direction. But with all of the COVID cash that we received, it's 225 days cash on hand, which looks just like last month. Profit and loss for the month of April. Revenue was 1.2 million, it's 1.6 million below budget. Expenses were $2.9 million, budgeted 2.7, so 218,000 over, because we were doing additional spending on wages and supplies. Net gain, net loss for the month was $1.9 million, budgeted 129. For the month, we're almost $1.9 million below budget. No surprise, we knew that was gonna happen. At our year-to-date P&L, I was looking at when we talked in February, we were, for our revenue, we were within 200,000 of our budgeted revenue. And now we are below our budget by $2.5 million. Our expenses in February were $20,000 away difference from budget, and now we're off by 633,000. Net income or net gain year to date is now at about a loss of $1.9 million, budgeted at $1 million, so we're $3 million behind where we wanted to be. All because of COVID. In February, we were only off on that net gain by $200,000. Okay. The balance sheet, you see that our cash is going up. Went from 2 to 14. Our patient AR went down last month from 8 million to 5 million this month. And our liabilities, because we did record this all as debt, even though several million of it I anticipate to reallocate it from debt to income, miscellaneous income, when our CPAs bless that. So that will change, but for right now, it's all in debt. So our net income went down, and our debt went up, and our cash went way up.
Just for a health district, as far as the cash, is it just cash or do we
Yeah.
have any type of CD or anything?
Washington Fed gave
CDs
us,
are worth about nothing.
yeah, I think it's 1.5%. I mean, it's kind of gross, but the state investment pool, which typically was the best place to try to invest, because it's fairly liquid, we can't put it in anything that's even at all risky, but it's down to 0.75. So while Fed is
It's better than.
trying to give us, at least it's better than SIP. So we have all the money that we can in that account. So that was it for the hospital. Does anybody have any questions?
Questions?
So then I believe we need to talk about our,
You know, you'd think on a normal business, to see something like this,
fine.
you'd jump out of a tree. It's so hard to imagine. And yet, as a critical access hospital, what we know is that from a reimbursement standpoint, this will get sorted out in the next 7+ months.
Unfortunately, we're in a position where we have no cash. It's sorted out.
Right.
And try really hard not to spend it until we're pretty sure we get to keep it. And then we spend it really very mindfully if we feel like we have to. So we're keeping very close track of it in The next thing we need to do is to do the resolution on the budget, which you were all at the budget meeting. Do you have any new questions on the budget?
Not, do we hear a motion to approve?
That we already did.
No, we
The
have
budget
to,
committee did,
yeah, we have to do it here.
yes.
Oh, I have approved,
Make a motion to approve.
I make a motion to approve the budget presented by the budget committee.
Second? Seconded, any other questions? Not, all those in favor signify by saying aye. Okay.
Then they have to approve the budget committee membership renewal.
Could you remind me again of who we have those names, are they the names of those that we
So Don
asked?
and
Steve
Steve said that they would agree to serve another term.
and Judy said.
Judy said she would serve for a 3-year term. So you're accepting those changes that they said they would do, add to the budget.
So then do I hear a motion to accept the renewal, 2 new renewal memberships and 1 new member to the budget committee?
Also,
Second.
just state the names for the record.
Okay. Any further question? Not, all those in favor signify by saying aye.
Aye.
The next item is an unbudgeted item, and I think I sent this out to you. So PAPRs, you have to understand a little bit about how we have dealt with infectious diseases in the past. So historically, while we had N95s, we didn't use them. It's really for patients that would have Ebola or would have tuberculosis or some communicable disease. So when we had them, we didn't use them a lot. We also have what are called PAPRs, and those are units that are, you have a mask and a gown and a helmet, and it reprocesses the air within that. And it's protecting the employee. We bought our PAPRs, and we have about 12 or so. We bought them several years ago. I think they're in excess of 5 to 7 years old. We haven't used them a lot because we haven't had a call for them. What we found is that they're older, but one of the things that the staff members wear when they go into a room, they put on this bodysuit and all of the helmet and things to protect them. They also have a shroud that goes over and protects them. We haven't been able to get replacement shrouds, and these are disposable items. Given that, and the reason for it is the brand. The company that we bought these from is a fine company, but they're not as readily available as the current vendor has them. And those, we could get a lot of these disposable shrouds. So after evaluating the age of our existing PAPRs, they're like any material that deteriorates over time. It made sense to replace the PAPRs with newer equipment since we could use the COVID-19 financing for that, because they are absolutely vital for taking care of patients, especially when you have a limited number of properly fitting N95s. So one of the things that everyone found was, yes, we have the N95s, but it's hard to find N95s that fit small faces. And so there's been a shortage of that. Well, people that are a little smaller are fine in a PAPR. So you need to have a combination. So I agreed to purchase for $17,000 these PAPRs. they last for a long time, the shrouds are the disposable products, and there are some others, disposable
Does
products.
that give us about 12, and that's them again, we had 12.
And that, we think, is an adequate number, so we're not buying in excess of what we would normally need. And it allows staff members to don and doff these without, that's taking them on and taking them off. Put it-
Charlie, then would that come out of this year's budget?
And it would come out of COVID-19 funding. So we have placed the purchase, so it would come out of this year's budget, not next year's. So I'm asking for approval, because it was a non-budgeted item. And that's what I'd like to add.
Your motion?
Full cost was how much, 17?
$17,000. They're not cheap, so we take them very seriously. And so we look for the best price we can, but sometimes, even if we get the best price, and then over time, it's not the replacement parts or some of the companies we buy things from, they're out of business after a certain amount of time.
Any further questions? If not, I'd entertain a motion for the approval.
I so move that we agree to fund the $17,000 for the new Pepper gowns or systems.
Moved second. Further question? Hearing none. All those in favor signify by saying aye.
Aye.
Aye. Resolution 2023, the lease with First American Bancorp.
And you guys.
And about 14 pages, as I remember.
Well, we could have added more.
That was plenty for me.
So one of the things that we've looked at is, in our goal to acquire the neat things that we can, sometimes we get financing that's pretty aggressive through some of the lease companies. First American has been pretty aggressive at their rates, and they've been willing to put in several of the items that we purchased into that lease. As we got close to having the agreement signed, we wanted to have a board resolution to grant me the authority to enter into this lease agreement. We've not done that in the past, but we ran it by our attorney. We have seen the resolution. It is it's a better way of ensuring that I'm not buying things that you're not aware of, and then financing it in ways that you're not aware of. So essentially what it's doing is ensuring that you have adequate information.
Is it for this part?
Pardon?
This is for the respiratory?
No, we put several items into this. It includes the, if I've got it right, the ultrasound machine, the second ultrasound machine. Remember, that was a 200,000+ unit. We got a gift from the Collins McDonald Foundation for half of that, and we actually bought two. So we had some of the financing for that and some other items that you have approved, but we could preserve our cash better by financing.
Do you recall what the actual amount of all the stuff added up was?
Sure. Do you have?
Yeah, it's on the lease. Yeah, sorry.
I didn't bring the actual
So
document.
that's
I did.
is it a quarterly payment?
Yes,
Yeah,
Yeah.
around 13,000, is that?
280,000. No, that's what I'm looking at here. That's all right, I used to look it on the computer and all. You want the whole thing now, okay. Print it on page. Maybe just the 280,000. It's 280 plus 25 plus 26, so 330,000 is the total amount of the lease. The lease had to be signed for the entire amount of everything we were buying. But then they deduct after that the 100,000, because I had to give them the 100,000 that we were gifted. So it's sitting in their trust account. And so when this all gets signed, then we'll finish that all together. Put it all together. But the lease, for whatever reason, because they wanted it to be, had to be for that whole amount. Because because they made the payments to the vendors. They wanted to pay the whole amount to the vendor, not part of the amount. Protects their investment. Okay?
They were good purchases, it's a good financing tool. In the past, you had granted me the authority to do this. They wanted to have a board resolution. We had our attorney draft that up, and that's what we're asking you to put the board resolution.
Well, I so move that we approve resolution 2020-3, lease with First American Bancorp.
Is there a second? Second. Been moved and seconded. Further questions? Hearing none. All those in favor signify by saying aye. Aye.
Thank
Goose Lake Medical Services. Cheryl.
All right. Long-term care, Goose Lake, Lakeview Gardens. Kind of plugging along, 623 patient days in April, which equates to 21 patients. And assisted living, 330 days, for days, equates to about 11 patients. Lakeview Gardens had revenue of 219,000. Still down from their high. And assisted living at 46,000. This is down about 4% from their average, but they have been kind of greening around on these few months.
One thing to keep in mind is as this COVID pandemic has been prepared for any impact, we have limited anyone going in and out of the facilities, and we have been very careful about if a person has to come out of those facilities to put somebody back in. We've been very cautious to protect the patients that are there. So you have not seen more people going in, and that's why it's been a little more stagnant. Again, to protect everyone, it's been our goal.
Yeah, nobody's moving much. Okay, so for April's profit and loss statement, we had a total net revenue of $248,000. We have $2.3 million for the year. Prior year, we had $1.9 million, so we are $400,000 ahead. Expenses, $300,000.
We're talking about contract labor over here.
Oh, yeah,
Yep.
yeah. It is still very high.
And that contract is mostly CNAs and.
Yes. Still very high. Revenue's up, expenses are up. The net loss for the month was 99,000, a little higher than I'd like to see it. $1,084,000 for the year, 1.2 million was last year, so we're a little ahead of where we were. Given the COVID declines, it might be not so bad. Keep those people safe.
In the payroll protection plan, does payment of contract labor count?
I don't think so.
No, I don't think it does, because the people who employ those people get that money there. Yeah. Sorry. Lake Medical Supply had a $30,000 month, and we're paying our consultant who's helping us to make a lot of changes, and we had an $8,000 loss for the month of April. And I did
This will
send,
turn eventually.
well, I did send you.
Maybe not in your lifetime, though,
Okay.
John.
Did you all read the budget I sent you today? I did send you Lake Medical's budget. We've been working with Steve on it, and I did
didn't see any
finally.
brackets.
But there was something about a move in
Yeah.
there as well.
Yes.
You want to talk about that? Or,
Probably Charlie knows more about it than I do.
okay,
So we talked in past about our current location, and how there would be some improvement with synergy. We don't have a location right now at our current Lake Health Medical Supplies office for the newly hired respiratory therapist who helps in fitting the masks and the sleep apnea equipment. So to find a place, we are actively looking at several and are close to having a location. The challenge about finding a location is Medicare doesn't really appreciate if you move medical supply companies very often. So we want to, across the country, there's often opportunity for fraud in the medical supply business. It's called durable medical equipment. And it often happens if they are businesses that are set up in sort of fly-by-night companies and they move frequently. So moving is a trigger for Medicare to look at. And so we don't want to do it very often. So we want to be thoughtful about where we relocate. We're very close, but very quite finalized.
Anything else, questions or loose lips? Not, we'll move on to item number 6, COVID-19 update. Charlie.
As I'm sure all of you know, on our public health website as well as the hospital website, we report that we have had 2 presumptive cases. See here the number of cases that we report daily within our staff.
What do you mean presumptive?
So a presumptive case means it is, it may be considered positive, or we may be treating them as though they are positive. So if a person has many of the symptoms and we take the test but we don't have a result back yet, we still treat them as though they might be positive.
Within the 2 we have for true positive tests.
The definition of that is not exactly always clear. So the people that they were not admitted to the hospital to treat, so they were self-isolating. Okay?
Okay.
You probably know, or if you don't, the governor announced this afternoon that phase 2 would occur tomorrow for Lake County and Klamath and Douglas County and several other counties. Phase 2 will start for Harney County on Saturday. There's a whole list of where the counties are, so that will be impacting our community. We are going to be changing some of our screening processes next week as we find ways to make it easier to check patients and ensure that both the public and our staff are safe. So there'll be some slight changes in where we do our screening and how we do it.
But we're not letting visitors in because of patients and stuff. Phase 2.
There is still some discussion about how many visitors can come into the hospital. The governor has not decided. It's hopeful that that will come out tomorrow. But there's a group of chief medical officers from many of the leading hospitals in the Portland area, as well as chief medical officers from some of the outer line hospitals, advising the governor's office on ways to be safe, but also to be a little more open, if you will. So that issue of how many people can come in, there's lots of language that goes into that. It's still trying to restrict people in a prudent way, but not necessarily in an appropriate way. So some of the lifting has been during the midst of the crisis. If a person was just admitted to the hospital, they couldn't have a visitor. Then if they were close to dying, then they could have someone come in, but just one person. Now it's becoming a little bit more relaxed. You still can't have a whole family come in at the same time. So it's being negotiated.
And that's just for visitation to the primary intensive care
It's to the hospital. The language is specific to acute care, renal dialysis centers, and ambulatory surgery centers. We still, because our clinic and our outpatient services are in the same building, we use many of the same restrictive criteria so that we don't have people roaming the hospitals. Again, that puts potential patients and our staff at risk, so we want to protect them. And that's our first and most important goal, is to keep people safe. Does that answer your question about how that process is working? What's basically happening is we have not seen in the state of Oregon a surge. We have not seen, even since the loosening of some of the restrictions that we had as of May 1st, and as that phase one, we have not seen undue increase in number of cases. So it's positive. And we still want to be safe.
Any further, Charlie?
Any questions at all about COVID that I could maybe answer or redirect you?
Now, I assume that we're doing tracing now when there is a positive.
Absolutely.
The public health nurses.
Absolutely.
Yeah.
Yeah, yes. We are, as part of moving to phase one, we had to have the ability to do contact tracing within 24 hours of the person being identified. What our medical staff actually agreed to is that it be done as soon as possible and well within the 24-hour requirement. So we've been fortunate we have not had patients present to emergency room with the condition or have been admitted, but we are doing contact tracing within the 24 hours.
Is that time-consuming workload for public health?
No. It does take time. Part of the issue is you have to call people, try to reach them. Sometimes they are readily available, sometimes they're not. Sometimes they only have cell service or don't have cell service. I mean, there are a lot of complications that go into it. But it does take time to do. And Judy and Jill and their crew have been doing a great job.
Okay, thank you, Charlie. Move on to item number 7, ambulance service update. Good to see Alan and Jeannie and Chuck here. Charlie, you want to go ahead and address that?
Sure. Things are progressing. I think at the last board meeting, I talked about how the Lakeview Disaster Unit had submitted a letter to the county commissioners. The county commissioners accepted that letter and requested to the state of Oregon that the ambulance service area, the ASA, be transferred from the Lakeview Disaster Unit to Lake Health District. So that process is underway. Our consultant has been very involved in working with, God bless you, the crew to meet all the requirements for the state. One of the things that normally happens in a transition like this is that the state would come and inspect the facilities, inspect the vehicles. They are making exceptions and taking pictures, or accepting the pictures that we take of the equipment and the locations, some of our personnel files, some of the things that they are normally required. We don't have a clear date yet from the state when they will accept that. Jen advised me this morning that an application for the CLIA license, that's the ability to do lab testing on site or any kind of testing,
Testing and stuff.
glucose. Those testing, our application has been approved, so that's a good thing. We got a little bit, we had to address an issue with the naming of the vehicles and got that resolved. We brought out a candidate, we've done some interviewing of people, we brought out a candidate, and we're in the process of sorting through that. Hopefully we'll have somebody that we can announce will be the EMS service director. We We have a lease agreement that is being discussed with the Lakeview Disaster Unit about utilizing their equipment. And we're working through that. Seems to be, we have accepted applications from all or most of the staff. As part of the process, the currently employed people within the disaster unit will be employed by the health district. That is a requirement. And then we also have to go through and have all of the volunteers have to fill out an application and then go through a criminal background check, all the normal requirements. So we're going through that process. I think it's moving as fast as we can. I just don't have a date from the state on whether they actually will come out and inspect it, whether they will accept the vehicle. Often they require a vehicle inspection. Alan can tell you horror stories about how long it took and how difficult it was for him to get the vehicle inspection. I'm told we might be able to get that if they actually have to physically inspect them. We might be able to work through that. There's still a little bit of uncertainty.
Are they being responsive to returning call?
The state, I would never say that the state does not respond. I would always say that we are persistent in trying to get answers as quickly as we can. If the state's listening, please. We appreciate all kinds of responses. Don't do anything to assume that we're not getting a response fast enough. But we do operate at their pace.
Is there a cost factor to us for their inspections and so forth?
There are things that I'm sure that they'll find ways to help us help the state in their evaluation process. I don't know if Chuck or Alan want to say, or Jeannie wants to say anything more.
Yes. Questions?
So, every year, or every 2 years, depending on what you're doing, they'll charge you a fee to relicense what you already have. The issue I had with the ambulance was a new rate to us that we had to have inspected. Once it was licensed, it's good to go then. So I just relicensed it, and it wasn't an issue, even though it was just licensed, 3 months ago, 4 months ago.
Was it inspected then?
Well, I guess I'll try and make a long story short. We got this rig, it was a federal excess property vehicle, so we didn't have to pay for it. But it's on loan from the federal government. We equipped it, probably $80,000 and more into it to equip it. Our previous administrator, we thought, had licensed it. When it came time to renew the license, we found out that had not been completed. It took 6 months to finally get it through, and what it came down to was new regulation that went in, said that every vehicle had to have an emergency vehicle technician inspect the vehicle. I could find one in Portland. There was one with the city of Bend. And if it was an intergovernmental thing, they said that that person probably could have done it, but because we're an independent agency, they didn't want to take on the liability. So after 6 months, and I'll say it, the state was very unresponsive, very unresponsive.
Alan can say those things.
I'll join in, because I think you guys need to be aware that you might be.
But anyway, finally they said, well, you started this process before that regulation went into effect, so we'll just let you go ahead and license it.
And I think that was only because we went to Lynn Finley and the representatives when they came to town. with a letter saying all the different things we had tried to do with the state to get this done. And I think he intervened and helped us out. I'm sorry, I wish I could be more positive. There are people in the state that try their hardest and want to do a good job, but they have had so many changeovers and so many new people.
And new regulations.
You're gonna have to, whoever your director is, have them learn the ORSs and all that stuff right away and keep up on the changes. We can't keep up on the changes. And it's just frustrating to no end. You think you're doing good, you think you have everything there, and then, oh no, you need this now. And hey, pay this fee now. So be prepared. Keep a really good diary of who you talked to and what they told you. So when you go through this, you can say, now wait a minute. This is what you said here. Why is it different now? So.
You mentioned ORS, is it more predominantly OARs?
It depends.
Yeah, it's the ORSs that then go into the administrative rules. So it's a mishmash of both, and I don't know that they always track from one to the other.
I think that's really true. They'll change part, but they'll forget to go on the next step and change the next part. And so to say, well, wait, it's like the form that Alan filled out. It had all the old stuff. He filled out this form exactly. And then they all went, well, why didn't you do this? Well, where does it say in this application to do that? That came after the fact.
Yeah, this vehicle was inspected by an ASE certified mechanic, filled out the state required form, but they had changed it and didn't update it, for example.
So we paid for the fee to have the one mechanic do it, but that wasn't good enough because now we had to have the special mechanic that doesn't live in Lakeview.
Well, our target was, when we started discussing this, was trying to get this done by June 1, but we don't have the authority to do that yet. But is the disaster unit good to keep running things till we can get approvals?
We still have our license and we'll keep going as long as we can money-wise. I think that's the big issue there.
And once I get one little bit of data, I'll be putting in for a new license, which would be due the end of June, but not knowing for sure how long it's going to take. We're here for the community, and we don't want this to, well, it can't lapse.
It's crucial for our community.
Yes,
certainly.
And we're hoping that this is still a merger, not a takeover.
Yeah, we might be coming and asking for help before you guys really can say, oh yeah, we can do that, but somehow to make it work.
I think it's so important that we keep the communications open because it is unlike anything that we thought it was going to be. So if we can just make certain that we're trying to let each party know as we go along to make it as smooth as we can. And Jeannie, I really appreciate what you're saying, and that will be helpful for the new person coming on board to know that, okay, this is reality, what you
I think Brent has done a good job and tried to provide a lot of information that way. But I think you really do need your director here as soon as you can get somebody. And I'll put a good word, I liked Mike.
I think our whole board thought that he'd be a real asset to the ambulance service district and the community. Knowledgeable. We didn't have much to pick from, but he's the real deal as far as we're concerned.
So if I can ask a question, I guess, about intent. I'm not on the board, but I hear things from, different sources, especially working at the hospital and hearing things, from the side. I really don't have a clear understanding of, I hear that this is going to be a partnership and a merger from one side, but then I will hear from another side that the plan is to just totally do away with the disaster unit. And that, you know, if we need to, we can get paramedics that are looking for a job. And so I guess from the board's perspective, are you looking at this as a partnership, for lack of a better term, or do you see this basically with the volunteers and the disaster unit just going away? Maybe not a fair question, but it's been weighing heavily on me.
I can only speak for myself, and we need you. I'll just put it that simple. And I just look at it from the community standpoint, whatever that takes. And I don't know how that's going to look for certain, but we need you.
Well, this is new territory.
Yeah.
I mean,
That's where communication.
And that's why we're here to participate,
Sure.
is because we believe that too.
Yeah, I guess speaking for myself, I think that, first key step is getting the right person hired to be the director. And then creating a structure that is both paid professionals and volunteers working together is how I see what would be best for our community. Now, how that's all gonna work, and I don't know yet, but I think we can work through those things and do what's best for our community.
well, and I mean, when the disaster unit started 70 years ago, it was a different picture than it was 30 years ago. It's a different picture than it is today, and who knows what it'll be in 20 years. And
But Alan, I just think that on behalf of the board, that we're here to serve the community really as well as you are, and that's our goal. What that looks like, I don't know. But bottom line, that's what we want to accomplish.
So can I ask a question, Charlie, of you? Do you have, or does I guess it could be the board too, like any idea of how the director, who he'll report to, or what that human resource position flow chart would be?
Yes, I do. That person would report to me. And that's for now, just because it's a new service. I have a lot of people that report to me. And as it gets, as we've taken on more things, I can't handle too many more things. Organizations or entities keep reporting to me. So my goal is to have, I'm not sure how that will flow. What we all need, I mean, I don't know anything about ambulances, I barely know a lot of the terminology. So it's not like I'm ever going to be an expert on that. So I'm expecting that our EMS director is going to know a lot of that and then need lots and lots of input. And I'm hopeful that the disaster unit will provide lots of input into how things have worked and how they can work. I also expect that the EMS director will be responsible to make sure that communication with the community, communication with the disaster unit works as best as it can. And that's what I would hope would be the case.
Hopefully we'll have somebody on board soon, right? Hopefully.
Yes, that is administrative position is key.
It is.
And we will introduce them to Representative Finley.
Yeah. Any other questions that you have that we could help you with? Answer tonight?
Unless you guys got other questions of us.
Anybody questions?
I know I've been giving a lot of information to the consultant as he as things come up. So we're there for a resource to provide you with what you need to make all this come together.
I like to think that Brent has been very helpful.
Yeah.
And he's certainly very knowledgeable. I rely on him to help us find the best solutions. So many times I don't have, number one, I don't have the time. And number two, I don't know about it. So I think he tells me he talks with you frequently.
Oh, yeah, we're all right there for him, anything he wants, we try to get for him.
And so,
And Charlie, I assume that we'll keep him on for a bit as we hire this new person to help get him in place and be successful.
we are certainly asking that. I can't speak to what his willingness to be beyond the,
But I think it's
putting the deal
important
together.
that
I think he will be
this
interested.
new person has all the support we can give him to get this thing working great for our community. I think Brent will be a good resource.
I believe that's the case. I've been impressed that he has been willing to come even during this COVID-19 travel issues and has been very responsive. So I'm hoping that will continue.
Brent's got family ties to this country too, so that helps. He wants to see this work.
Oh, is that right?
Yeah,
Great.
I didn't know that.
but anyway, like I said, he wants to see this work because he feels, connected to this country.
Thank you for being here, we appreciate it and all that you do. Medical staff update.
Dr.
You don't see Timothy Gallagher, MD here.
He's in the emergency room,
Okay.
or he was just a little bit ago. I don't think the medical staff has had a hard time conducting a lot of their business just because they've been focused mostly on dealing with COVID issues and processes that we have.
And we really haven't had any privileging that have had to come up. I think in June we'll have a couple more that they'll have to vote on, so we'll probably see them in July.
CEO report. Charlie.
Well, aside from the things we've talked about, I don't have a whole lot to say, just a couple things. When we took on mental health responsibilities 5 years ago, one of the requirements that we have is to have a medical director to oversee how we are delivering that service. And we tried to get one of the family doctors to act in that stead, and the state said, no, you need to have a psychiatrist. We thought we had arrangements worked out with our mental health contracting entity, GOBI, Greater Oregon Behavioral Health Entity, but that never came to fruition. I'm pleased to say that I have contracted with Dr. Kimberly Human, who is a psychiatrist based out of the Dalles, and she is now contracted with us and is acting as our medical director, plus providing oversight for some of the more advanced therapists. So that's a really positive thing for us.
And that's a resource we haven't had.
That's correct. The requirement from the state is that you have a psychiatrist. A psychiatric nurse practitioner was not qualified. It had to be a psychiatrist. So it's been a long hope, but we've gotten that resolved. So I'm pleased about that. Dr. Gayla Keneally, the family practitioner that we contracted with back in November, has now arrived. She is now in Alturas. So as she's getting ramped up, we should start seeing a good relationship with our clinic there and some increased volume from that community. Dr. Stevens continues to be a practitioner that is based out of our clinic. His name is Wesley Stevens, right? He's had some unfortunate things happen to him in the last 6 months, so it's been a little bit challenging for him. Tony Reynolds continues to be our family nurse practitioner who has been a bedrock for us. So it's a really positive thing for us. One other thing, please keep in mind that we're starting our summer food program. I talked about it last meeting. That'll be starting up shortly. It will include Hazel. That was a new addition. So we'll be able to provide, for those of you that don't know, we took over this responsibility a couple of years ago when Head Start was relocating, and they didn't have a ability to make lunches. So we started doing that, and it's grown significantly to where we have 2 sites here in Lakeview, and we'll be providing meals for kids in Paisley.
Where are the sites?
One site is right behind my swimming pool. Normally, we've been to the kiddie park right down here on 7th. There is some concern about state requirements having access to slides and equipment that kids can play on that might not be sanitized enough. So we're not sure if that is absolutely going to be the location that we provide lunches to. But that's an important.
And again, Charlie, the number of lunches that we provided last year, considerable.
It was considerable. Off the top of my head, I don't recall, but it was in the thousands. So and what made it really wonderful in the past years has been many of the service groups and various organizations have participated in passing out lunches for kids and participated. Not sure we're going to be able to do that because of COVID-19 issues, but if we can, as the governor allows us to, we can provide. It's wonderful.
And Charlie, we confirmed today with our vendor, since we don't have daily days this year, and that's one of our big pushes to get the bike helmets out to the kids, the summer food program will have the helmets on hand, so kids that need them will have access to them.
So one of the things to keep in mind that we've been doing, and many of the businesses have supported the centers, is we've gotten bicycle helmets for kids when they're riding their bicycle. And one of the incentives several of the businesses have done is provided passes. So if a police officer sees a kid wearing a helmet and give a little pass and then get a free ice cream, it's been a very positive thing and encouraged kids to wear their helmets. So we will continue doing that, and is a great incentive. We want kids to wear their helmets. John, one of the things you asked that I talk a little bit about is how do we deal with our all of the contract labor, and the fact that we have so many temporary agency people. We have not, since Melinda retired, found a person to be in the role of teaching the CNA classes. So we are right now working on job description to encompass a little bit more than that, and hope to have somebody hired as soon as we get that all resolved so that we can start teaching the classes again. That will help. We're talking, Rebecca and I are talking about the possibility with maybe long-term care of going where some of the labor force is to encourage them to come to our small community. Some of our kids that are, or people that are capable of working as a CNA or working in some of our facilities. If they're not interested, maybe we can bring some people here. Similar to the agency workforce, only not through an agency. So we have several different plans that we're working on and have been. We got a little bit pushed aside because of some COVID stuff. But now that becomes less of an issue, more focused on it.
As we talked, Charlie, and I think working, Teresa's not here tonight, but we have the Patricia Gainey Fund and looking at those scholarship opportunities and how we might be able to take what we have and make it better and attract more people and pay less contract labor. So I think, my perspective, I'd certainly be interested in working on that. I think it's tricky.
We certainly got a big boost by, God bless you, a big boost by the donation from Providence and then an anonymous donor that will help fill that pool of money for people to take classes. So that's a great thing. We'll keep pushing. One of the reasons that Teresa's not, oh, no, here she is.
Oh, we're talking about you.
Oops, made you lie, sorry.
Teresa has been engaged in interviewing, well, she can tell you. That's why I didn't think she would be here.
Oh, I just thought I'd pop in for a minute. KCC nursing student interviews, I was doing them on Zoom. That's a new experience because they can't do live interviews right now. So things are really improving at that program, I'd like to say, thanks to all of our work and collaboration with them. So we got a new dean a year ago, and they've had some changes now in the nursing faculty. So I look for that program to put out really high-quality candidates. So it's always good to see new applicants with stars in their eyes and wonderful goals of helping humanity. So that's what I've been doing.
Great, good.
Do any of you, that concludes my comments. Do any of you have any questions on anything we could address?
Teresa, anything else that you would like to comment on, or?
I'm a little bit out of sync here, so no.
Okay. Good, all right. Do we need to go into executive session?
No, we don't.
If not, then I will say we will conclude at 7:38. A new record